We're presenting briefly some recent works by the Health Disparities Institute team on medical mistrust, health insurance, medical debt, COVID disparities, and health equity among boys and men of color. An article in Medical News Today by Dr. Powell: "We rely on carceral settings to provide a range of behavioral health care which was woefully inadequate even without the additional demands produced by COVID-19. Each article has the original source online. A Business Insider article by Dr. Powell: "As a trauma psychologist who focuses on the physical and emotional impacts of racism in the lives of black men and boys, I'm especially concerned about the trajectories of emotional well-being for the scores of children whose Father's Day has been permanently altered." An article in Behavioral Medicine on medical mistrust and racism: "Our study supports prior research in detecting that higher mistrust of medical organizations when examined alone is associated with delays in African American men's routine health visits and blood pressure screening." Another article in Medical News Today: "Radical healing means acknowledging that the seeds of black Americans' mistrust of mental health providers are rooted in centuries of medical malice and racially biased care." Another one by Dr. Villagra and the team in the American Journal of Managed Care: "Health insurance terminology and use rules confuse consumers, especially racial and ethnic minorities." This is a map of percent non-white residents by zip code and total dollars of small claims medical debt in 2018, and these two are related significantly. An issue brief by Dr. Villagra: "Medical debt is the most proximate cause of real harm to families' health and financial well-being, especially to low-income racial ethnic minorities and the uninsured." Another one in Yukon Today, which says, among others, in Connecticut about 12,000 people are sued in small claims court every year. New York Times this time is quoting an article by University of Connecticut Health Disparities Institute report finding that 80,000 patients are sued for medical debt between 2011 and 2016. Medical debt could get you sued, NBCConnecticut.com. Dr. Villagra's research shows that court rules in the hospitals favor 99% of the time. A graph showing that the death rates due to COVID differ in Connecticut by race ethnicity dramatically. Another map that shows the distribution of new cases of COVID-19 by towns. The highest rate seems to be 30 new cases per 100,000 residents in Mansfield. Another article in Connecticut Mirror, which concludes, "Despite the many COVID-19 uncertainties, it is evident that the highest number of lives exposed to the virus will be lost in the highest medical and socioeconomic risk populations." A Donahue Foundation article by Dr. Villagra trying to understand the consequences of dramatic reduction in the number of services available to the public. Connecticut News Junkie, Dr. Powell: "COVID-19 is a double threat to the health and economic security of communities." Hartford Courant: "Why we need to be talking about health equity during the coronavirus pandemic." And from the report card on health equity among boys and men of color, there are disparities by race, ethnicity, and life expectancy, and deaths within age groups due to different leading causes.